Have you ever experienced frequent headaches or leg pain? Sometimes these discomforts could be a whisper of a more serious health concern, like nerve damage. Nerve damage, or neuropathy, is a condition that disrupts the normal functioning of your nerves, affecting communication between your brain and the rest of your body. It's like a broken telephone line, causing all sorts of miscommunications. But don't fret, we're here to help you read these signals. Stay tuned as we uncover the 5 signs of possible nerve damage you should not ignore. Firstly, one common sign of nerve damage is numbness. This can occur when nerves, which act as the body's communication lines, get damaged. This disruption can lead to sensations like numbness in different parts of the body. Nerve damage can be caused by various conditions, including diabetes or physical injury. Ignoring this symptom could potentially lead to more severe health issues, as it might be a sign of underlying conditions. So, if you've been experiencing unexplained numbness, it might be time to consult a healthcare professional. Next, we have excessive sweating. You see, nerve damage can disrupt your body's ability to regulate temperature. How does this happen? When nerves are damaged, they may send false signals to your sweat glands, causing you to perspire excessively, even when you're not exerting yourself or in a hot environment. This is a cause for concern, as it could indicate underlying nerve issues. So if you notice that you're sweating more than usual, don't ignore it. Remember, unusual sweating patterns could be a red flag for nerve damage. The third sign we're looking at is frequent urination. Nerve damage can impact the body's ability to control the bladder, often leading to uncontrolled and frequent urination. This happens because the nerves that carry messages from the bladder to the brain and vice versa can become damaged, disrupting these crucial signals. This is a serious symptom as it indicates that the nervous system is not functioning as it should. It's important to pay attention to such changes in your body. Never dismiss frequent urination as it could be pointing to nerve damage. Moving on, frequent headaches are another possible sign of nerve damage. Now, you might be wondering, how are headaches linked to nerve damage? Well, our nervous system, including the brain, is a complex network of communication. When nerves are damaged, they can send false signals, and sometimes these signals can manifest as pain in various parts of the body, including the head. Headaches can also be triggered by nerve inflammation or pressure on the nerves. Now, it's important to remember that headaches are common and can be caused by many things, from stress to a poor night's sleep. But if you're experiencing headaches more often than usual and they're not linked to any known causes, it could be an indication of nerve damage. Nerve damage, if left untreated, can lead to a host of complications, from muscle weakness to mobility issues, and even organ dysfunction. So if headaches have become a regular part of your life, it might be a sign of nerve damage. Lastly, we have leg pain as a potential sign of nerve damage. Nerve damage can disrupt the normal functioning of our legs, leading to discomfort and pain. This happens when the nerves that facilitate communication between our brain and legs are compromised, causing misfired signals. This miscommunication can result in feelings of prickling, stabbing, or burning pain in the legs. This symptom is significant because it could seriously affect a person's quality of life. It can make simple tasks, like walking or standing, a challenge. It can disrupt sleep, cause difficulty in movement, and even lead to disability in severe cases. The pain could be intermittent or constant, mild or severe. It can also be accompanied by other symptoms like numbness or muscle weakness. These variations make it even more important to seek medical attention if you're experiencing persistent leg pain. Persistent leg pain should never be ignored as it could be a sign of nerve damage. To recap, the 5 signs of possible nerve damage we've discussed are numbness, excessive sweating, frequent urination, regular headaches, and persistent leg pain. These signs are not to be taken lightly, as they may indicate underlying issues that could potentially harm your well-being. Numbness can be a sign of nerve damage, as it suggests a lack of sensation in certain areas of your body. Excessive sweating or frequent urination may point towards autonomic nerve damage, affecting involuntary body functions. Regular headaches could potentially indicate a trapped or damaged nerve, while persistent leg pain may be a sign of sciatic nerve issues. It's crucial to understand that these symptoms can be indicators of something more serious and should not be ignored. If you're experiencing any of these signs, seek medical attention promptly. Early detection and treatment can prevent further complications. Remember, your health should always be a priority. Don't ignore the signs your body is giving you. Stay safe, everyone.